Yes, good friend, everyone who is here today. I've come so late, and it's because sometimes I become so busy, and you cannot come online. You understand some things when you are working, the schedules of work, and sometimes they are so uh, uh, you can't balance. But we thank God I have some time. We are not continuing with herbs, but I've just received some emails requesting me to talk about the normal fecal oral. When I'm talking about fecal oral diseases, fecal oral diseases means when you eat, drink some foods that are contaminated, and you get a bacteria that is disturbing you. That is called fecal oral foods. Just a minute. This is you see now fecal oral means the food you eat and destroys, but there is a particular uh, specific there is a specific bacteria called Salmonella typhi that causes typhoid. We want to discuss it because it is become so rampant, and people are asking, they are being treated, and they are asking me to talk about Salmonella typhi. What is typhoid fever? You see, typhoid fever is not in your stomach. Typhoid fever is in a minute, just a minute. I'm trying to connect some issues here. Typhoid fever is systemic in your blood. That typhoid is inside you in your blood. So when you are taking food and drinks, no, sorry, you should know that if it is infected with typhoid, with that bacteria called Salmonella typhi, you'll get affected, and you'll start having the diarrhea, restlessness. You understand all those. Now let's talk about typhoid fever. What is typhoid fever? Many people sometimes talk about typhoid fever without knowing what they are talking about. It will be a quick coverage of this, so we will know. You can sometimes you can take food that is not contaminated and you don't get typhoid. We will know why you get typhoid. Now, typhoid fever is a systemic infection mainly caused by that Salmonella enterica serotype type. Salmonella typhi, it's a bacteria spread through contaminated food or water. When you drink water, or you eat food that has this bacteria, you will get it. Those people that love taking food that is street food, you will get sometimes people are not hygienic. They wash baby shosh in the house. Welcome baby shosh. We are talking about typhoid. Typhoid. People always say, I went to the hospital and the laboratory, they took some samples of stool in the laboratory and I got typhoid. So tomorrow we will continue with our normal topics, but today I've said it is late, but I have to cover typhoid fever. Primary cause is Salmonella typhi. It's a bacteria called Salmonella typhi, mostly in Africa and South Asia. People that are in India, you've seen Indians, the food, street food and hygiene in India sometimes. Even here in Kenya, at times it's one thing. Yes. So related, there are other species of Salmonella typhi called Salmonella paratyphi. So when you are walking, most of us, we don't care where we eat. We want to save some money to eat cheap food somewhere, and then you don't know how the food is being prepared. Let me tell you, if you get Salmonella typhi around an eatery, a restaurant, and there is no hygiene and sanitation around that place, even water, the whole of that place can be contaminated. People, we should be having good hygiene when it comes to food and when it comes to water that we drink. If where you get your water is a well and this bacteria is in that well, you may be getting this problem. Hmm? There is very many places that you can get. So I've said Salmonella typhi is not only in the stomach and the food you eat, like amoeba. It is systemic. It goes in your blood. So if the person you are with next is not hygienic and you are sharing some things, some fluid, like you're kissing your partner anyhowly, you are doing. I'm here on two devices while I'm getting ready to run out. Yes, Uncle, today is a very short. I'm just talking about typhoid. I want people to understand what typhoid fever is. It is called typhoid fever because it causes fever in you. It is in your blood. So, transmission, how is it transmitted? Fecal oral, contaminated water and food, poor hygiene, chronic carriers, e.g., infected food handlers. You see, someone may be working in a restaurant and this person has Salmonella typhi, spreading it every time to the customers through food. You get it? That's why restaurants handlers, before you start serving food, before you start doing some things, you have to have that certificate of food handler certificate. You be done the tests, you be treated if you have it, so that you be clean. Salmonella typhi, you can be a carrier without knowing. I remember sometimes back before people, a story of a lady that was before people in that is the past. This lady was a carrier, and every person who went to that restaurant to eat became sick. You get it? We will talk about it as we finish. Now, risk factors: unsafe water, street food. I've talked about street food because street food and food handling in the streets is very wanting. Overcrowding and poor sewerage. Poor sewerage. Now, how does this bacteria? You see, you have eaten food. You are having a diarrhea, but how does this bacteria destroy you? Hmm? Yes. How does it? Bacteria is injected and it has a coat that survives the acid in your stomach, like a coat. You get it? It survives, invades the small, it gets to the small intestines. Eh? Invades the small intestines. They are called the pious purges. It invades the immune system. It invades the immune system. When you get a bacteria in your body, your body should release the soldiers, to fight. Yes, thank you. Marcia. Marcia is in the house. Thank you so much. Welcome. So it invades. So when it invades, it spreads. Your body, let me give you a little secret. Your body does not just have the vein and arteries. It has something else called the lymphatic system. The lymphatic system is like the veins and arteries. It picks excessive fluid from your muscles, and returns it to the veins. So in the lymphatic system is where this Salmonella typhi of typhoid spread so fast, because most of the immune markers, the cells that fight the bacteria, are not a lot there. So it spreads and it goes up to the liver, the spleen, the bone marrow, and the gallbladder. Now, when it gets to your liver, it stays there. So that's why some people, when they are treated they are treated typhoid, you still go back several times, you find this person is still testing positive of typhoid. Because of what? Because maybe he was not given a good dosage, so it is still in the liver and the spleen. They hide there. Cause bacteria, it causes many bacteria. They spread. That is a condition called bacteremia. Many bacteria in your system, and systemic illness. Now, if they are getting and staying in your liver, I'm talking about the normal typhoid that the normal typhoid, and typhoid kills. You see, if typhoid can stay in your liver, and the incubation period is from 7 to 14 days, 3 to 60 days is 3 to 60 days is maximum. You get it? You get it? It can kill you because you'll be diarrheaing every time, and having destroying the liver. It can destroy your kidney. It can destroy your your gallbladder, and even the spleen. You start having the yellowness in your eyes, and then you start having stones, kidney stones. You see, it is very important to know these symptoms. Why? Week by week progression, this is how it comes. Step ladder fever. Your fever starts to be little, it graduates to another, it goes up to 40, it from little. It's not like the fever that comes all of a sudden, then it, if you take drugs it goes. No, this one is step ladder. It goes slowly by, at it graduates. If you start with a fever of 37, it goes to 38, then 39, then 40 tomorrow. You get it? Because when the bacteria are growing so fast, it is stepping up to, and then you start having dry cough. Why? Because it is systemic and it is spreading even in your lungs. Typhoid fever, typhoid is not a good thing, and the people live with it without knowing. You know, they are chronic carriers of typhoid. People that have typhoid, but they don't know, they are just spreading to other people. Typhoid. Relative bradycardia, because it is systemic. Bradycardia means your heart beats slowly. Your heart beats slowly. Constipation and diarrhea, because now your stomach cannot hold anything, so it just passes and passes and passes. Now that happens in the first week. Step ladder, growing, headache, dry cough, relative bradycardia, and constipation and diarrhea. Now, the second week is the burst week. Burst week, you see, you burst. Every symptom comes after getting. Remember, the incubation period is 7 to 14 days. Between that day, you don't know you have anything, but now you start having gradual, the week by week. The first week, you start graduating from the 2 weeks. Now, the third week, you start graduating with the fever. Now, the fourth week, hey, fever, I've said it is the burst week. It bursts out. Yeah, fever goes high, abdominal pain because of diarrhea. My friend, you close your eyes, diarrhea. You open like this, you have already diarrhea. Typhoid fever, disseminated through the whole body. Even sometimes it goes up to the kidneys, hides there. It's like dysentery and cholera. Then, because these salmonella typhi things, they stay in your liver, you start having hepatomegaly. Your liver swells because it's killing the liver cells, your liver cells. Then you have some spots, faint salmon rash on the trunk. Around here, you have some spots. We call them raw spots. Even some places in your liver. Just imagine your kidney swelling and you having some spots in the liver. We call it raw spot. If you are diarrheaing every time, and if you touch your right flank here, you feel that it's kind of like swollen. If you want to know you have you are swollen, the liver is swollen in your body, just raise up your hand, drop it, hold below the ribs. You will feel a hard mass that is protruding, and then you have diarrhea. Please visit a hospital, be checked for SAT, something called salmonella antigen test, to confirm. You see, now this is the fourth week. It has busted. Even you are diarrheaing, pea soup stool, like whitish. It is like a soup that is whitish, and then another constipation. Yes, please don't just be surprised with this video. These are things that happen. Like the video, share it to a friend. Draw spots, and then the other week, the third week, without proper medication, severe toxemia. Now the whole body is with toxicity. Bacteria are everywhere. You have diarrhea. You don't even have some energy. Delirium. Even your head. Encephalopathy. Encephalopathy is when your brain gets confused, and sometimes you start having hallucinations because of electrolyte imbalance. What are electrolytes? Sodium, potassium, those ones. They cannot balance in the kidney because you are not getting in anything. You see, as we continue, don't just watch, ask a question, give me a challenge, please, as we continue. Week 4, you have been treated, you start having gradual recovery. You get it? Now, that is called typhoid fever. I know someone is confused how typhoid fever now can give even problems in your lungs, in your liver. You see, that's why we are here. That's why we are here to help even each other. Now, we have said, let me go through again. We have said it's just a short session because someone has asked. If you have anything question about typhoid, ask now. Ask. We eat a lot when we go out. Some people, we don't have time to buy food, to carry food from our house. We wake up so early and then we go. So we don't have that time to buy food. We eat in eateries. And in those eateries along the restaurants that we are walking, a good set restaurant, a person who is serving and a person who is cooking, this person should have a health food handler certificate from the public health. You have done all the tests in your body, they are sure you don't have this. You can't be a carrier of salmonella. Now, I want to tell you today that you can be a carrier of typhoid and spreading it through people. And you've seen why? Because it goes up to the liver and stays there. So if the treatment you are getting is not good, you will continue suffering the typhoid and spreading it. Now, we have said the agent of typhoid is called Salmonella typhi. That bacteria is Salmonella typhi. Where it stays in you, in human. That is the reservoir. That is where it stays. It cannot stay anywhere. Spread through contaminated water and food, poor hygiene can shed bacteria for long time. You see, yeah. Typical symptoms are like prolonged fever, headache, malaise, headache, abdominal pain, and in the stomach, you'll get constipation and diarrhea. You get it. And relative low blood pressure or the heart beating so slow because you are diarrheaing, you don't have enough volume in your body. And then we go to an advanced stage where the liver swells because of many bacteria handling and destroying the liver cells. And then we have the rose spots around your trunks. They are pink macules on the trunk, not always seen, but you'll see some macules around here. Can cause confusion, delirium in severe disease. Confusion, we call it encephalopathy. Your brain gets damaged. You get it? Usually after 2 to 3 weeks, you can have bleeding. You go to the flu, you get digested uh, stool or raw stool. You get it? Urine culture often later you will see some, even in urine you can get. You get it? So you go when you go to hospital, they'll do full blood count, they'll do liver tests, we call them LFTs, liver function tests, and then we will do something called Widal test. Widal test, less reliable nowadays, we don't do that, but we can do something called microscopy. We take your stool, we check, we identify this is Salmonella typhi. Or we do something called Salmonella antigen test. You see, with antigen test, we identify it's a strip. It detects the antigen of Salmonella. So treatment on local resistance, common effective is azithromycin and ceftriaxone injection because you cannot take drugs. It is systemic. So if you want to heal faster, you give injections called ceftriaxone, and then some antibiotics called fluoroquinolones. So let's talk about prevention because that is the major thing that we really need to do. Prevention of people not getting this bacteria called Salmonella typhi that is one, before anyone goes to work in an eatery or somewhere, this person should be screened, have a certificate is clean. This person should not be a carrier to other people. Should not carry this, you are spreading through touching everyone, touching food. Yeah? you go home, it is related to HPV. No, no, this is not HPV. We will talk about viruses. HPV is called human, Bibishosh is asking, human papilloma virus. That one we will talk. Very, Bibishosh, even you have told me that this week, tomorrow is on Thursday. This week we are talking about some viruses, and this one will be HPV. HPV is a virus, this is a bacteria. Now, we talk about we have talked about screening people that are working and work in restaurants and every places that serves food. First of all, safe water for drinking and washing hands is very important. Safe water for drinking and washing hands. Eat food that is hot and well cooked, because when you cook food, you see, our grandfathers, they usually boiled meat. They usually boil meat for so long and some foods in heavy heat. It killed so many bacteria. Nowadays, we are a creation of fast food. Even kales. Kales here in Kenya, we call it sukuma wiki. We want to put it faster. We eat. We eat some foods in restaurants that are not cooked, like salads. My friend, maybe that will change your mind about salads when you go to celebrations and eateries. Vaccines are always helpful, but not 100%. Because you see, if you get a bacteria, when you travel, sometimes you can be given a vaccine of Salmonella typhi, so that when you eat that bacteria called Salmonella typhi, your body has already known this is Salmonella typhi and this is how we will handle it, because you are already immunized. But sometimes it's not helpful, because there are some Salmonella typhi strains that are very resistant and they can be drown you like diarrhea. What kills you faster in this abdominal condition and systemic condition is the diarrhea. When you lose a lot of fluid and you don't have immunity, because if you lose a lot of fluids and electrolytes, you will not have immunity. Your body will be weak. So there is a vaccine called typhoid conjugate vaccine. Often that one is given when you are going at a place that sanitation is not there. So most of, and I'll tell YouTubers, as you walk out there, those that do traveling videos and people that like traveling, get this vaccine. It will save you big time. You have heard in Africa and Asia it is there. So please get this vaccine. And I know some countries you cannot go out without some kind of vaccines, even yellow fever vaccines. Now you know why. Now, that is about Salmonella typhi. Today we are not talking about a lot of things. Let's give a time like who has a question? Who has a question? You know, it here in Kenya right now it is 10 at night. 10 at night. Imagine, I've been just at work the whole day, and then I remembered, oh, I've not done a topic, and people had asked me to talk about Salmonella typhi. Let me do it faster before I go home. So who has a question? Like my video, guys. Let me feel like I'm doing a good thing and share to your friends. I'm waiting for questions. Any questions? Any questions, my friend, about Salmonella typhi? Have you ever got typhoid one day? I remember when I got typhoid when I was so young. I was admitted. It was hell. Sometimes I could diarrhea and diarrhea. You know, when you are a kid, you eat everything in school, whatever that your friend have brought. If it is not treated in the stomach, it can bring intestinal hemorrhage. You will bleed. It can perforate. You'll get ileal perforation. You'll get holes in the ileum. You get it? The intestine. You'll get holes. And systemic, you'll get septic shock. Septic shock means you have infection and it's causing a shock. In your brain, it will cause something called encephalopathy. You lose your mind. You become like you cannot think. You are not even knowing yourself. You get it? In the heart, it will cause something called myocarditis. Myocarditis is infection of the heart. Around the lungs, this thing will cause something called pneumonia because your lungs are undergoing inflammation and you cannot breathe well because all the pipes are constricted. You get it? I got it long time ago when I was young back home. You see, Bibi Shoshi is attesting. Eh? Pneumonia, that is systemic. And chronic carrier state. Where does that organism stays? In your liver, at the gallbladder. So it just, when it just wants to mature, it matures and produces. So you continue having, every time you are screened of typhoid, it becomes positive. You get it? So if every time you go and you're screened for typhoid and it becomes positive, find out. Tell the people to do something called ultrasound to check your gallbladder and some other tests to find out if it is staying there because there is their residence for life. You get it? So diagnosis, I've talked about it. We take stool. I learned a lot today, Dr. Ben, and you teach me to get vaccines whenever I'm traveling. Yes, uncle, you are a strong guy, and we will always want to be with you around. We don't want to hear that uncle is in Asia and is sick. No, get vaccines. Now, how do we get to know? Diagnosis means how do we get to know someone has typhoid fever? We take your blood, we do culture. If it is positive in the first week, we know you have it. We know. We take your stool, we do positive, we do stool antigen test, a strip that tests the antigen, or we do microscopy. But if it is persistent, my time is just about to go, I go home. I've been at work since morning, imagine, at 6. Now, we take your bone marrow. After taking your bone marrow, what do? We check even after antibiotics because it can be resistant to some antibiotics that we use. So we check after the bone marrow if it is still there or if it is resistant to the antibiotics that you've given so that we can continue treating you. It does not go to the gallbladder, you become a carrier. There is something called Widal test, the antibodies O and H, that one I've talked about. Now, when you do a full blood count, because your liver is suffering, what can you get through this? You will get leukopenia, you will get mild anemia, you will get elevated liver enzyme, and sometimes thrombocytopenias. Find out what these are. The treatment I've said is azithromycin, ciprofloxacin, ceftriaxone. Those are injections. But to support yourself so that you can heal faster, what do? Hydration, take fluids. I've not said water. People take a lot of water thinking, no, I don't need that, Dr. Ben. Don't people take water thinking, a lot of water thinking that it's fluid. Take water, fluids that have electrolytes and nutrients. Soups, take, you understand? Take soups, take vegetables, take fruits. Those are soups. Soups are fluids. Water is for dehydration if you feel you are thirsty, but drinks are for nutrients. So rehydrate, get nutrients so that you can. I have 2 minutes. No one has a question today. As I'm ending. And eat well. Eat well. We have talked about vaccination, how to handle these issues, safe drinking water, hand hygiene, wash your hands. I've not said sanitizer. Take soap, wash with running water, not sanitizer. That is not hygiene. Take soap, wash with running water. You get it? That is sanity now. Proper sewage disposal. Some people don't have good sewage system. Talk to your government. Dig holes around. Good, proper sewage disposal. Good latrines, good toilets. You don't want to spread typhoid. Food safety, very important. For chronic carrier state, some people continue shedding bacteria after recovery. So if you test twice, you find you are still positive after treatment, after a month, go do MRI, go do biopsy from the gallbladder, let them find out if it is there. Treat with prolonged antibiotics. And you may confuse it with what? Malaria, dengue fever, brucellosis, tuberculosis, and viral hepatitis. So it is important to do these tests so that you don't confuse with malaria. They share symptoms. We call it in medicine differential diagnosis. So don't just take drugs. Do lab tests. No. These are as I finish. This is the last thing I want you to know. Key exam point. The most things that you will see and you know this is typhoid. Step ladder fever, low blood pressure, your heart beating slowly, the raw spots that I've said, leukopenia. Leukopenia is cells, white blood cells of immunity dropping, intestinal perforations in the third day, you getting diarrhea blood. You have blood or digested blood. When you go to the loo, you find digested blood. And blood culture earlier, stool later. You get it? Now, those are the key points that will make you know this is typhoid. Thank you so much for listening, my friends. Please, thank you so much. Hey, Savia man. My friend Savia man, my first time. The bad thing is Savia man is coming here as we finish. Now, Savia man, tomorrow I'll be live at 4 Kenyan time. Where is your state? Savia man, where do you stay so that I can know what time you will be here? I'll be here at, I always come live on 16:30 Kenyan time. So find out at your place what time. Savia man, like the video and share. But remember, tomorrow I still have a topic at that Kenyan time. Find out if it is 16:30 at here. What time will it be at where you are? What time will it be? So I'm in Michigan. If it let me see if let me get time in Michigan. It's 16:30. I'm finding time in Michigan. 30 in Kenya. What time? Let me see what time it will be in Michigan. It will be 8:30 a.m. Now, at your time, Savior man, it will be 8:30 a.m. in the morning. Yes. So that is the time I'll be online. Now that everyone doesn't, and Savior man, I have so many lives on treatment. Please go through them, share with your friends. Let me build a community, just as we help and grow each other. Thank you so much. No one has a question. Please ask me a question before I go. Please. I like questions. A doctor that loves questions. Okay, if no one has a question, here people that are in Kenya, sleep tight. It's morning in the US. People that are in the US, you sleep, you have a good night, and always don't go to bed when you are angry. Solve an issue. Go to bed when you are. Hey, Beauty, hello Benjamin and everyone. Beauty, today we have talked about Salmonella typhi. Please start this video from the beginning. It has been so interesting, and you will learn a lot. We'll learn a lot. Tomorrow we are continuing with our herbs. People that love herbs and they are confused about the herbal treatment and the hospital treatment. Tomorrow we are going to treat malaria with herbs. Imagine. Malaria is in Africa. In Africa, we are going to treat malaria with herbs. And then we treat it again with hospital drugs, then we see how our grandfathers and us we used to be. I will replay it. Thank you so much, Beauty. I think one day I'll meet Beauty. I'll go to South Africa to meet some people. I'll get some time. We will arrange with Jamaican uncle. We go to visit. Beauty is quite a darling, a good lady. CJ Rehab is in the house. And Benjamin the Wise, is that already a vaccine for malaria? Yes, 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 Xavier man. There is a vaccine for malaria. I will I'll talk about vaccines. We know, but do you think we can get a vaccine for HIV/AIDS? And if it is there, after we talk about vaccines, can someone allow to be given the vaccine? Topic of one day. After we talk about vaccines and we know how they work. Hmm? We know how they work. We will see if someone can accept to be given it. So have a lovely evening, everyone. As I go, I want to say bye. Please share the videos. Let's meet tomorrow at 16:30 Kenyan time tomorrow. We treat malaria and with both herbs, and we treat malaria with our drugs. Bye. Sleep tight. Bye bye.